Rabia Mollette. She is an emergency medical physician out of Brooklyn, Brookdale Hospital Medical Center in Brooklyn. Welcome, Dr. Mollette.
How are you during these
Wonderful.
interesting times? And I say that as I roll my eyes and I just can't deal right now. I'm like, I had to turn off social media and everything because it was just too much. It was just way too much.
Yeah, I actually turned off my social media and now I feel disconnected. Like I told you a little bit earlier, I was out searching for storms, so to speak, here in Detroit. Couldn't find any. Pretty uneventful for the places that I've gone to.
Hmm.
Nonetheless, let's get into you. Go ahead and introduce yourself to our audience, and we will go ahead and talk about some of this election fatigue and or policy that's going on today.
Yeah, because I'm fatigued from working in the front line of the pandemic. I'm tired of Trump. I'm tired of all these people. I'm just tired. Okay.
Right, 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 right.
My name is Dr. Arabia Mollette. I am, well, an emergency medicine physician, but in the streets, you guys say ER doctor. I work at a level one trauma center, so meaning that we take care of all kinds of traumas from gunshot wounds to God knows what
Mm-hmm.
at a hospital in Brooklyn named Brookdale University Hospital Medical Center in the heart of Brooklyn in Brownsville, East New York, which is in two areas that are high crime, extreme poverty, um, and even working class. It's a mixture of everything and all in between. I did my initial medical training back home on the island of Cuba. So shout out to Cuba.
Okay, that's home for you. I was wondering. Well,
Mhm.
good. Okay.
Yep. And I told y'all earlier that I'm tired. And
We gonna keep it moving. We gonna keep it moving.
no,
So
because I mean, tired in a sense where, I mean, although I am physically tired, but tired in a sense, with just everything that's going on
yeah,
with the
absolutely.
pandemic being politicized, to the pandemic being hotep size. You know what I mean by, the hoteps
Yeah,
spreading misinformation. So hotep
absolutely.
size. And just, just the overall selfishness that our culture, I would say has been, but even has worsened
Mm-hmm.
since since for the past 4 years. And it's quite frustrating.
Mm-hmm.
Trump again coming out saying that doctors are making money, doctors and hospitals are making money off of COVID. And I'm like, wait a second, what is he talking about? Where there are hospitals that are being closed right now. And a
Mm-hmm.
lot of doctors and nurses are furloughed or got laid off, well, basically laid off and not even working
Right.
because of the pandemic, because the hospitals are not able to afford their own its own employees, which is really sad. Because if you don't have doctors and nurses to take care of the people, who do you have? Who do you have left? And for
Exactly.
him to say that and then turn around and get a multi-million-dollar treatment, well, when we say the $1 million treatment at a facility that provided him with the best of the best of best care that the average American, whether you black, white, Asian, Native American, that did not receive or hadn't received since the inception of this country,
Mm-hmm.
it's a big slap in the face.
Mm-hmm.
And so it's tiring where for me as a person or as a black woman physician being on the front line, I've been in practicing medicine for many years, at least 10 years, I believe. Oh God, I'm aging myself. And so,
No worries.
it's just horrible. It's been a horrible experience. And I know that I've been impacted greatly. As many of you may know, that New York was the former epicenter, and we were hit the hardest,
Mm-hmm.
and we were greatly impacted, and to the point where people don't even know half of what we were going through. And now we're slowly but surely coming out with our stories, because I don't even think the United States or the world really realized how devastating the pandemic was to New York, and the amount
Right.
of stories that are coming out of it. And so, I do my best trying not to cry so much of all the people that had died in front of me at the
Mm-hmm.
emergency department. But, at times when I think about it, I just get more frustrated and angry. So I had to pull back and really take care of myself, especially my own mental health and physical health, because it really depleted my soul.
Wow.
Just dealing with all the craziness from the pandemic, and including losing co-workers,
Oh
including
wow.
losing, friends of mine that died from
Mm-hmm.
it, and even almost a family member. And right now, I currently have a friend that is hospitalized with COVID-19, and I'm really worried about her.
Wow, wow, wow. That is a lot to unpack. And my condolences to you and your family and the people that you've lost in this struggle. It's definitely an understatement to say you're tired. So I definitely understand and I get that.
Yeah.
But
And I'm
let's,
pretty sure everybody's tired of it too.
yeah, oh yes, absolutely. Everybody. We called it election fatigue earlier, but it's so much bigger than just the election fatigue.
Right.
It's the COVID fatigue. It's the social media fatigue. So it's a
Yes.
lot that's going on at the
Yes.
same time. The loss of people fatigue. Like it's just the 2020 is
Yeah.
really one for the books.
Right. Right.
So so today is election day. So with all of the excitement and anticipation surrounding the election, how does one go about preventing and or reducing anxiety and stress? Because we're feeling it right now. So how do you go about reducing it if at all possible, especially today?
Well, I would say to unplug from social media, and I'm not considered a millennial. I ain't gonna say my age, even though you know.
You look like you 25, girl.
Thank you. Oh, God bless you. You really
Absolutely.
like pulling my brace. Thank you so much. But no, I will say that I know it's hard for many of us, whether you're a millennial or not, because there's people in my age group that are also on social media. Shoot, I'm on social media. But I think one of the best ways, the methods to take is actually de-stressing yourself or just cut down social media, unplugging from social media. Social media is a blessing and a curse at the same time, because by the time you're on the phone and you realize that, it's 6 o'clock, you already spent 3 hours on social media and not even realize it because the time go by so fast.
Right.
And so I would say do your best to cut down, because it can be anxiety provoking.
Mm-hmm.
It can affect your mental health. And to be honest with you, if your mental health is affected, then it's obviously going to affect your physical health and vice versa.
Mm-hmm.
So cut down on social media is another thing. And also the second thing I would advise is to double down on the stressful habits that one have. If you are too busy to the point where you're not resting, if you're not taking time to really sit and think in a quiet space, or at least to meditate and pray, and whatever those stresses are that is adding stress to your life, you have to sit down and reevaluate that and really
Right.
tell yourself, is it really worth my time and my energy is it worth giving my time and my energy to this? When I during that at the, I was on the front line, still is on the front line.
Mm-hmm.
And even at the height of the pandemic, by the time during at the height, and I don't want to say towards the end, but I want to say that as New York, for us, when our numbers started coming down, you would think that it was like, whew, such a release, but it wasn't. It was
Right.
very depressing, because for one, we were dealing with, again, with the politicization of COVID-19, with the
Mm-hmm.
upcoming elections, and then all these misinformation and disinformation that was being spread. And
Right.
so when our numbers came down, I started to realize how a hectic life that I had. And I needed to pull back. And so I needed to cut down my hours from work. I had to I enrolled myself in therapy because I was struggling with with
Wow.
post-traumatic stress disorder
Mm-hmm. Mm-hmm.
related to COVID. And I needed that. So you might want to consider sitting down and really taking a moment to kind of figure out which stresses are in your life that is really taking your attention away from things.
Right.
And the fourth thing is that plan, have a mental and physical health plan. If you like to exercise, do it. If you haven't exercised, try to. And it doesn't have to mean that you have to get a Peloton bike or you have to have a gym membership, but you can go outside with your mask on, take a 15-minute walk. That's
Yeah.
cardio in itself.
Yeah.
If you can do 5 or 6 push-ups a day to
Mm-hmm.
at least get your to activate your nervous system, then do that. But really take that time to really invest in yourself and really have
Mm-hmm.
a plan in terms of, when I'm going through this, what is my next step?
Right.
And not wait until the last minute where all hell break loose and then you're feeling like you're in the dark and you
Mm-hmm.
didn't take those initial steps to be able to prevent that. And the last thing is to have hope. I'm a person, have been through a lot in my entire life, and my
Mm-hmm.
story is something else. And I would say that one thing that I've always believed in is hope and faith. When
Right.
all else, when I could lose everything else, but as long as I have my faith and hope, I could be able to get through any adversity.
Mm-hmm.
And so I will say for this upcoming election, just do your best to have hope. I pray that, we get through this election and that people vote responsibly and not vote to spite their nose to
Yes.
harm others.
Yes.
And just do the best you can. You can only take it one day at a time. And that's what I had to learn from all this. Take it one day at a time and learn to say no. And that
Yeah.
no is a complete sentence.
I think that is very key, especially during these times, because we're already overwhelmed. We're already full of anxiety. It's already a lot going on. And so just exerting yourself and asserting yourself and saying, no, that's it, no explanation. I think that does big things to your self esteem. So,
Exactly.
yeah.
Exactly.
You touched on something. I know we don't have a lot of time tonight, but I want to get into your story because you said your story is woo. And of course, it made me want to learn more about your story. So we do have a lot of questions, but I'm interested in your story. Can you give us a little bit about, your background, where you're from, how you became the doctor, all of that great stuff?
Well, you're looking at somebody that came from the streets.
Hmm.
I became a teen mom starting at the age of 16, and unfortunately, my son was murdered later on, and then my one of my sisters was also killed years later. And I grew up in a family that was extremely poor. We grew up in extreme poverty, and I had to learn to survive and
Hmm.
learn to figure out ways how to survive, even with very minimal resources. And so I am writing a book about that because it's going to take like forever for me to even get into the whole schmitz of things, because that's just one snippet of my life story. But when I speak with purpose. I speak with intention because I understand. I'm not somebody just because I have ND at the end of my last name. It doesn't mean that Dr. Mollette don't know what time it is, because she's been
Right.
there and done that. And
Hmm.
nothing is new under the sun for me.
Hmm.
I was also a gunshot wound victim. I was also a former domestic violence victim. And so you name it, I've been through it for the most
Hmm.
part. And
Hmm.
so it's something, and everything that I do is in honor of those and that was very important to me that have passed.
Hmm.
And I always say my ferifun, and that's in Yoruba, my ferifun, Alegba and Orishas, and my ancestors. But I give praise to God and to my ancestors for allowing me to embark on this journey.
Hmm.
I didn't understand it initially as a child growing up in a household with drugs and crime and domestic violence was an everyday occurrence in the
Hmm.
household, and not at times not having your parents to be parents because they were
Hmm.
in their crisis. But
Hmm.
when you grow up in that, and then not understanding it as a child and then as a teenager, but then as you become older, you start to see things a little differently. And
Yeah.
part of it is because of going to
Hmm.
therapy, professional therapy, and that helped a lot in terms of trying to at least understand what's happening. And
Hmm.
I don't utilize, and I was a very angry person, of course. But one thing that my grandmother used to say to me, she was like, Molette, whatever problems that you have in your life is just temporary.
Hmm.
Let go and let God.
Mm.
And then my Cuban auntie back in Cuba, and I'll say this in Spanish and then I'll say it in English. She said, El Señor nunca daré una visión sin los recursos. That means God never gives you a vision without giving you the resources. And so
Mm.
I've learned to carry that through, despite anything that I've gone through in my life, whether I just had, very little or nothing, is that whatever the vision that God has given me, I know that God will provide.
Hmm.
And one of those resources was actually to go to therapy.
Wow.
And I'm saying this and to encourage people to seriously consider going to therapy, whether you see a psychiatrist or a psychologist
Hmm.
or a licensed social worker that is a credential as a psychotherapist. It is very important to seek help, because
Right.
the mind and the body is not separate entities. When your body
Hmm.
is affected physically, it will affect your mental health and vice versa. I think we
Yeah.
have an issue in this country, or especially in this country, people look at mental health and physical health as two separate entities, and that's
Right.
really the wrong way of looking at things.
Hmm. Hmm. When you said your story was woo, I wasn't anticipating like woo. Yes, thank you for sharing your story. Definitely, it's touching. Of course, we see that you're on the other side of it now, but it's emotional.
Right.
It had me tearing up over here. So congratulations to you
Thank you.
for number one identifying that you needed the mental health and the therapy, and number two, go on and get it.
Right.
It's a lot of people out here that might say, okay, I need to go see somebody, but don't act on it.
Exactly, exactly. Or they went to go see someone. Well, I didn't like that person. I'm like, well, you're an adult. You know that you can change, right? Just like you change underwear. Well, some people might not, but just like,
People might
so
not.
what I see sometimes at work, but you know,
Oh, don't tell it all. Don't tell it all.
shout out to my people. But as a joke, but again, if if we can sit there and invest in time in getting our nails done, or
Yeah.
invest in getting a new phone, or doing things that you enjoy to do, you got to invest in your own health, and that's really important. And so,
Hmm.
and it's unfortunate because I don't know where the state of healthcare is going to be. I'm very concerned because as an ER doctor, we are the first to see how rapidly a healthcare system can collapse, and
Yes.
our healthcare system is collapsing
Hmm.
severely and rapidly,
Hmm.
unfortunately. And so, with this issue with healthcare, it's not just Black people affected, or Black and brown people. It's everybody that's going to be affected by the uncertainties of what this is going to be if Trump wins.
Yeah. Yeah.
We always talk about the Affordable Care Act and how it allowed those who have pre-existing conditions to be able to still be insured, but
Hmm.
that's being challenged as we speak
Hmm.
in the Supreme Court. And so my concern is that how if it gets challenged and it gets eliminated, we're even going to be having more. I mean, we already millions of Americans already lost their
Right.
insurance, but
Yeah.
how much more millions of Americans are going to be uninsured? That's the part that scares me.
Yeah.
And if you're uninsured, I wish we could do away with health insurance company. I wish we
Yeah.
could have a single taxpayer system.
Hmm.
But it's really gotten out of hand, and the
Hmm.
people who are getting caught in this is not just the patients, but the doctors and nurses. We're caught in the middle because we don't even have control of what's going on.
Yeah. And you touched on it. That was actually one of my questions, with the results of the presidential election pending, and some reports saying that we're not even going to know who a president is for 2 3 weeks out. I read a report earlier that said New Jersey wasn't even going to begin counting their votes until November 10th. With all of that taking place, what impact will the results of the election have on national health care? Do we know?
I don't think so. Honestly
Okay.
speaking, I don't think so. I think at this point, everything is such an uncertainty. And I think this is
Hmm.
why it's like really anxiety provoking,
Hmm.
because we don't know.
Yeah.
And it seems like every state is just doing their own thing. As you
Hmm.
can see, where every state has been working independently more so than ever. And it's kind of like, wait, they can do that over there? And it's like every time I turn around, I'm like learning more about the Constitution. I'm learning more about these different state laws that,
Hmm.
to be honest with you, a lot of us aren't aware of it, and that we should be more aware of it more so than ever. I will say this, like I know that people, I look on social media and at times, and I even posted it about Obama, but people are like, oh my God, I miss him. I wish he was still in office. But the thing is that I felt like during the time that Obama was in office, I felt like even as a national community, whether Black and brown communities overall, we dropped the ball too, because
Hmm.
we also got a little comfortable, and a lot of us weren't being active in local politics.
Hmm.
And I urge people to get involved in local politics. Local
Hmm.
politics is so important, because these are the same people that are affecting your community, that are that can vote, that are voting or choosing people to step in certain positions, whether it be the mayor, whether it be the fire commissioner, whether it be the police commissioner, and also challenging, or your governor, and also challenging the hospitals, like funding for certain hospitals, and not looking at why is it that this certain zip code has a great hospital system, why is it in this area we don't have a great hospital system, and why is it our local hospitals are sorely underfunded. And so when I talk about local politics, it's like people looking at me like, what? I'm like, yes. Yes, this is important. You need to know who your assemblywoman is, your assemblyman is. You need to know who's your congresswoman, your congressman. You need to know who is your local senator. That is
Absolutely.
so important.
Yeah.
Go to your
Absolutely.
community board meetings.
Yeah.
Go to your school board meetings.
Yeah.
when they don't see us, they don't think we care. And then when these laws pass,
yeah,
it's too
and,
late.
and go vote. Today is the day that you can make a difference. Go vote. And speaking of voting, for the people that are voting in person today for the rest of the night, so they got until 8 p.m. Their local time zone. What advice would you give them to safeguard themselves against COVID-19? I know people have been voting since the polls opened this morning, but we might be able to save a couple people. So,
Right.
what advice would you give to them in terms of helping to safeguard themselves at the polls right now?
Well, I will say this. I know it's going to be, I know from personal experience as far as voting, because I did early voting in New York. Our early
Mm-hmm.
voting started October 23rd or the 24th.
Mm-hmm.
And so I went to do early voting. And even with that, it was very difficult for those poll places to actually control social distancing because a lot of people
Absolutely.
came out.
Right.
However, one thing I would definitely say is that a lot of people still had masks on.
Okay.
And then they were handing out masks to people who may have forgotten a mask or didn't have a mask on. And if you didn't have a mask, they weren't letting you come into the place until you put a mask on.
Okay.
So my thing is this, continue wearing a mask. It's going to be very difficult while you're voting to practice social distancing because once you enter into the facility, those booths are still close to each other.
Mm-hmm.
If you can't, while you're waiting on the line or before you go in, utilize your hand sanitizers. And because you're not going to have access to soap and water, obviously, so you need to carry
Mm-hmm.
that with you. And then when you finish, again, hand sanitizer. When you go home, wash your hands. But
Yeah.
just do your best to wear the mask and just protect yourself. That's the best thing that I can say to you right now while voting. And don't get intimidated by people. Don't get intimidated by those who are carrying out acts of voter suppression.
Yeah. Yeah, tonight, we are hoping to at least get a good sense, a good idea of where the presidential election will land. However, we may be in store for a couple more weeks to find out. Um,
Yeah.
in addition to the things that you mentioned earlier in terms of how we can reduce stress and or relieve it or remove it, um, what would you suggest to people that they do in preparation of the election results when we do find out?
Certain things I can't say live.
I like you, Dr. Mollette. Yes,
I told
I
you I'm from the hood,
understand.
right?
Yes, I
I told you I'm from the
understand.
hood. Yeah. I told you I'm from the hood. Um,
Keep it
whoo,
real. Keep it real.
uh, you got to defend yourself by enemies necessary. Do what you have to do, but
Yeah.
just be very careful in these streets.
Hmm.
Protect yourself. And I'm not saying protect. I'm not saying to protect yourself as to being violent. I'm saying even spiritually protect yourself.
Hmm.
And just know that whoever wins is it either way. It can the country can become violent or maybe not.
Hmm.
And so we have to do ourselves justice by protecting ourselves in so many different ways, unfortunately. And I know I've seen talks and friends of mine posting on social media how they are licensed to carry.
Hmm.
Okay,
Hmm.
okay,
Listen,
and
I'm taking my class. My
I
class.
mean, but you got to do what you have to do.
Yes,
You
absolutely.
understand? And
Hmm.
in this, it is what it is. And so, I don't condone violence, but I would say just be careful. Be
Yeah.
careful for these next couple of days because I don't know what's going to be like. I don't know what's how peaceful or unpeaceful people can be,
Yeah.
but just especially for Black people, Black young people, really be careful.
Hmm.
Out, I my padrino has said to me, and that means Godfather, spiritual God, well, Godfather in Spanish, and he
Hmm.
said to me, he was like, I I don't want you to be outside like that.
Hmm.
Unless you got to go to the store and come back.
Hmm.
Unless you got to go to work and come back.
Hmm.
Because I don't want any police or anyone, doing anything to you.
Right, right,
That kind
right.
of thing. So I was like, oh, okay, like just, all right, all
Hmm.
right, I'm gonna take that to heed because the uncertainty,
Hmm.
and
Hmm.
I'm not a conspiracy theorist and I'm not a type of person that be paranoid, but I do take heed to advice.
Hmm.
So, with these election results, I say that people just like, slow down, be patient,
Hmm.
check yourself, pray and just hope for the best. That's the only thing that's coming, that's speaking to my heart right now,
Yeah.
and other things, but
Yeah, I think I could read your mind on those other things. So
yeah, yeah, yeah,
well, it's definitely been a pleasure. We learned so much from you today. We love your spirit, your energy, and your story was very touching. So thank you so much for coming on Health IQ. It is election night. We are standing by to see what the election results will be.
yeah,
Like you said earlier, I unplugged from social media. I'm about to plug back in,
yeah.
just to kind of check in to see where we are in terms of the pulse of the nation and make
And
sure.
you be careful
Oh
as
yeah.
well.
Oh,
Please.
oh, absolutely. I was so surprised that we didn't see any of the things that I'm seeing on the news in
Right,
other places, other
right,
states, other polling places. So it's been pretty uneventful for the places that I've gone to,
right.
but that doesn't mean that people are not out there,
Acting crazy.
acting crazy for lack of,
Exactly.
yes, for yes, acting crazy. Let's make it
Acting
plain
crazy.
and simple.
Exactly. So before you step out of the house, ladies and gentlemen, you just ask whoever your higher power, whoever you call into your higher power is, or whoever your higher power is, and
Hmm.
ask your God to protect you and your family as you go out to vote, and even after voting while we waiting for these results. And I like right now, I'm just like being extra spiritual. I'm
Yeah.
not imposing my religious beliefs on anyone, but I'm just
Hmm.
really trying to go at it with a more spiritual eye, because the level of uncertainty like is
Yeah.
it's anxiety provoking, and I have to
Yes.
think straight and try to at least see some sort of hope and positivity throughout all of this.
Absolutely. Well, thank you again so much. We definitely appreciate you. Tell people where they can find you, follow you, hear more about your story. You're writing a book, plug your book, do all of that great stuff.
Yes, you can find me on Instagram. Look at me, talk about I'm not a millennial. You can
That's
find me
okay.
on shameless plug, right? You can find me on Instagram at Dr. Arabia Mollette on Instagram, also Dr. Arabia Mollette on Facebook. And again, I'm still currently writing my book. So I don't know when that's going to get published,
Mhm.
but I also have a podcast called The Visit with Dr. Arabia Mollette, and it's
Okay.
on actually on Apple Podcasts. It was called iTunes, now it's called Apple Podcasts. It's also on Spotify and SoundCloud.
I'm going to subscribe right now,
Thank you.
because yes, you have such a great spirit, and
Thank
we
you.
here with what we should do.
And the hair is flawless, honey. The hair
Thank
is
you.
flawless. I was like, look at her. All right. Put the
Thank
shade
you.
room on. Yes.
I appreciate it. I appreciate it. Well, we definitely gonna have to check back in with you,
Yes.
catch up with you a little later. Like I
Yes.
said, your spirit is so amazing.
Thank you so
Thank
much.
you again,
Thank
Dr.
you for
Mollette.
inviting me. Thank you.
Absolutely, it was a pleasure.
Take care.